Good evening and welcome everyone for today's English session. Today is our 2059th day of continuous webinar. Today's our speaker is Dr. JANKI HIRPARA. She is MD in Homeopathy. She is the Assistant Professor in the Department of Anatomy in Rajkot Homeopathic Medical College, Parul, Gujarat. Today she is going to take about urticaria. Dr. JANKI HIRPARA, you are welcome. Please. We are so glad to invite you. The young generation is accompanying us. Very glad. Thank you.
Can you hear me?
Yes.
My voice is audible?
Yeah.
Good evening to all. Myself, Dr. JANKI HIRPARA from Rajkot Homeopathic Medical College, Parul University, MD in Department of Anatomy. Today my topic is urticaria. Through urticaria, we learn about what is the psychological disturbance which trigger to internal disturbance which trigger to physical. Hello.
Yes.
My voice is audible, na?
Clear. Proceed.
Okay. ठीक है.
Dr. Janki, if you have slides, you can share.
Yes, ma'am. Today my topic is Urticaria Unveiled, a deep dive into psychological triggers and homeopathic healings. What is the urticaria? First of all, we know about the urticaria. What is the urticaria? Urticaria is defined as a skin lesions consisting of a wheal and flare reaction in which localized intracutaneous edema is surrounded by an area of redness that is typically pruritus. Urticaria is the functional changes seen in the skin appearance. Due to some triggers, we all know that urticaria flare up by some triggers. Urticaria can be defined as acute and chronic. What is the acute urticaria? We all know the acute urticaria means acute disease condition less than 6 weeks for the persistent continuous symptoms. It's known as the acute urticaria, and more than 6 weeks patient suffering from continuous symptoms trigger more than 6 weeks. It called as a chronic disease condition. In acute urticaria, some exciting triggers, infections, drug, food is possible. In some chronic urticaria, there may be not every time to possible there is a IgE mediated allergic condition. In sometimes there are in chronic urticaria some internal changes, internal triggers which can affect the chronic urticaria to the patient. We all know that patient complain that for the some triggering foods like bananas, apples, which triggers that condition. But not every time the food or some perfumes is for the cause of that disease condition. We all know that homeopathy believes in individualization. Every individual patient suffers from individual disease condition. Homeopathy believes that every chronic disease cause the fundamental miasm. It treat the root cause of the disease and constitution as a whole, not just the local disease condition. In homeopathy, we all know that urticaria is an external expression of the internal disturbance, and homeopathy believes in treating that internal disturbance with internal malady. For every individual suffering from urticaria will throw different types of the symptoms during that state, as well as every individual will be having different constitution, will have a different cause, either mental or physical cause, developing the urticaria. For that condition, homeopathic medicines will be differentiate for the each individual conditions. We know that the global burden about the condition of the visibility chronic urticaria. In chronic urticaria, some global occurrence like 0.1 to 3% worldwide prevalence due prevalence are there in chronic urticaria. In that, women are more like twicely occur urticaria rather than the men. In estimate, about 1 in 5 people will have urticaria once in their life. In chronic urticaria, up to 1% of population suffers from chronic urticaria. In chronic urticaria, peak incidence between 20 and 40 years of age. In most of cases, the disease lasts between 1 to 5 years, but the duration can be longer for those with severe urticaria, those with concurrent angioedema, those with physical component, and those with positive serum sickness test. First of all, we see the structure of the skin. What is the structure of the skin? We all know that layer of the skin, some epidermal, dermal. In epidermal layer functions about the physical, chemical, immunological triggers. There is some cells are present in the epidermal layer which play a different types of the role. Some key cells like keratinocytes, melanocytes, Langerhans cells, Merkel cells. In keratinocytes plays the barrier and lipid layer to the skin layer, epidermal layer. Melanocytes plays role about UV protections. Langerhans cells like immune surveillance and Merkel cells mechanosensory. Some other cells are present in the epidermal like stratum basal, stratum spinosum, stratum granulosum. In layer 2, dermal compositions. Function is the structural and functional hub housing the cutaneous vascular network, lymphatics, and sensory system. Structures like superficial papillary layer like loose areolar tissue, rich in capillaries, and deeper reticular layer, dense irregular connective tissue. Like urticarial symptoms. What is the symptoms? Physiological manifestation. We all know that wheal, flare, symptoms. Why this happened? For the wheal, we know about the wheal like localized circumscribed raised area of intracutaneous edema. It's rarely persists more than 24 to 48 hours. Because why this wheal appearance? Due to increased vascular permeability, drives the localized edema, H1 histamine mediated receptor and H2 receptor. For the flare, surrounding the area erythema redness appearance due to the vasodilatation. It's due to the vasodilatation surrounding redness and localized heat appearance. For the urticarial symptoms, we know about the most common symptoms like intentionally itching pruritus. Why pruritus itching develops? Cellular infiltration, delayed phase response features like neutrophils, prominent eosinophils, monocytes, etc. We know about the terms like wheals, heaves, or angioedema. Wheals and angioedema are the two different features, two different characteristic appearance on the skin. We can see on the screen like figures. There is the wheals and angioedema is different structure. Wheals appearance on the superficial dermis like epidermis, where the angioedema occurs at the subcutaneous or submucosal tissue. Here the red appearance on the epidermis is the wheal and the sky appearance on the subcutaneous fat or submucosa is the angioedema. What is the clinical features about the wheals? Well demarcated, red, pale swelling with surrounding flare appearance we can see on the skin. In the angioedema, some swellings, often normal skin color, there is no changes in the skin colors. In the wheal appearance, hues, like intentionally itching present due to H1 receptor activation. But in angioedema, due to swelling, submucosal tissue affected, painful tenderness are present that affected area. But there is rarely itching is present. For the duration of the wheals, it's usually within 24 hours. where the angioedema lasts from hours to several days. Resolution, reversible exudations, leaves no mark. There is the results without dryness or scarring. This is the difference between the wheals and angioedema. Sometimes the patient present with urticaria with angioedema, and sometimes patients only present with wheals, some itching condition. So here we can differentiate the wheals and angioedema. Types of urticaria: acute, chronic. Acute urticaria occurs after some viral infections like URTI, hepatitis, drug-induced, or food-related. Over 50% of walk-in cases remain unexplained urticaria. In some cases, patient doesn't know about what is the triggering factor to affect the urticaria. In some chronic cases, there is the spontaneous or inducible urticaria. In spontaneous, anytime with specific external triggers driven by the autoimmune or idiopathic NGs, and inducible like some physical or environmental stimulus which provoke the urticaria. Sorry. Some different types of urticaria like dermographism urticaria, delayed pressures urticaria, cold urticaria, local heat urticaria, environment, solar urticaria. Mechanical triggers to develop urticaria like dermographism, which is seen in surface like epidermis, and patient present 4.2% general population present with 20, most prevalent dermographism urticaria, which occurs by liner, wheals, or flare. Each scratch, after the scratching, the patient appearance like urticaria like this. For the delayed pressures, deep-seated, like constant pressures, painful swelling for hours, post pressures, like constant bell running. After that pressures, the patient's conditions develop symptoms reflect the redness, that is the delayed pressures urticaria. Cold urticaria, after some continuous exposure to high coldness, that result into the deep swelling about 9 to 18 hours post exposure, develop the cold urticaria. Local heat urticaria, within a minute of direct heat source contact, increase histamine and neutrophils and chemotactic factor. Some environmental factor due to the UV light, sunlight exposure, the wheals or angioedema shortly develop eosinophils, neutrophils, and post-chemotoxic post-exposure high rise, and then the urticaria develop. Some others type of urticaria like cholincheric urticaria, adrenogenic urticaria, exercise-induced urticaria, contact urticaria, or aquagenic urticaria. In adrenogenic urticaria, due to some emotional stress, triggers the reproducible via norepinephrine injection. Some stress factors which develop the urticaria, it's known as the adrenogenic urticaria. Or some exercise-induced urticaria due to continuous exercise which affect the body receptors, then develop the exercise-induced urticaria. Aquagenic urticaria, water contact at any temperature which leads to intense itching, wheals. This is the different types of urticaria. What is the pathophysiology role of the urticaria? How it happens? Then what occurs to develop the urticaria? First of all, most essential role of mast cell in urticaria. We all know about how the mechanism immune response developed to urticaria. The basic cell response is the inflammations. We all know about the inflammations. Some trigger factor upon the mast cell, which some trigger factor affect the mast cell, which activated and release the histamine, leads to urticaria. In all the types of urticaria, there is not required the same immune response. It not may be present same immune response to develop urticaria. there are so many different pathways to activate the mast cell, which affect the body and develop the urticaria. It may be activated by some foreign microorganism, physical factors, or maybe by the autoimmune response. We can see that in slide the first, second, third, fourth steps to role of the mast cell in the urticaria. In third or fourth step, there is the activation of the T cells mediated mast cell, which develop the urticaria. Some triggering factors to degranulations of the mast cells, factors like neuropeptides. In neuropeptides, of factors affecting like the substance P, vasoactivated intestinal peptide VIP, somatostatin, some extracellular matrix like the fibrinoactin and laminin binding via VLA3. VLA मतलब very large antigen 3, 4, 5 and beta integrated, which affect the mast cell mediated release, sometimes histamines, leukotrienes, cytokines, and chemotaxins mediated release, which result to pathological result like modified vascular permeability, which leads to enhance the endothelial adhesions, molecules, leukocytes rolling, and chemotactic migration. Some mast cell release level, some triggering factor, immunological triggers, allergens like autoantigens binding to IgE on receptors, some functional autoantibody, IgG, cross-linking binding to the IgE receptor, some non-immunological triggers, drug substance, opioid like morphine, codeine binding to the receptors, which leads to the mast cell activation and develop the urticaria. Some C5 complement symptoms, complement affect cofactor to develop the urticaria. We all know about this mast cell activation. This is the some short to understand what is the autoimmune etiology. First step, autoantibody targeting. In IgE binding with IgE receptor, target the IgE receptor, which leads to classical complement activation. In the classical complement activation, C5 receptor activates C5 generation, rapidly generates the anaphylatoxins, which leads to amplification. C5 bind to C5 receptor on the skin mast cell, drastically augmenting and amplifying the histamine release. Here we previously discussed about some factors affecting the mast cell degranulation, which leads to affect the develop the urticaria. Factors like physical stress, temperature extreme, autoimmunity, medications, food, contact allergens, or some respiratory allergens. In this slide, what are the involvement of the mast cell in the urticaria? In spontaneous urticaria, 78% of the mast cell involvement, inducible 65, chronic urticaria 85, autoimmune connection 72. In some autoimmune disease conditions, spontaneous urticaria, there is the IgG autoantibody directly attack and cross the patient's own IgE receptor. This causes the continuous and spontaneous degranulations, which leads to autoimmune conditions, particularly like thyroid disease, Hashimoto's, Graves' disease. In 25 to 30% of patients with chronic spontaneous urticaria, mast cell engine driven by the functional IgG autoantibodies. Here the understanding of the urticaria via the spontaneous, inducible urticaria, differentiating urticaria for their subtypes and chronic management of the urticaria. This is the graph of the urticaria, in which time durations the urticaria develop after the triggering factors. In environmental factors, some solar urticaria, aquagenic urticaria, after the triggering factor, it's developed. In sweating, thermal, mechanical, sweating, cholincheric urticaria on set is urgent, like frequent immediate development. In thermal, cold exposure, symptomatic dermographism, delayed pressures urticaria, after the sometimes it's developed. In allopathic, we all know about the allopathic treatment. First, we all see that morphology. What about the urticaria? Taste, some factors which triggers. In some case, there is some other treatment. In if some other disease conditions affect, we can call the some other intervention investigations. Here it is the diagnostic range for some high yield to targeting conditionals, low yield. Through history, identify the some physical triggers, basic blood samples like ESR, CRP, some thyroid screen condition, find out the autoimmune conditions present or not. Here, the differential diagnosis of the urticaria. Urticaria can be differentiation from the other conditions like insect bite, erythema multiforme, urticarial vasculitis. In the urticaria duration, there is the results within 72 hours. In insect bite, durations lesions more than 24 hours. In erythema multiforme, lasts days to week. In urticarial vasculitis, more than 72 hours. Lesion morphological effect. What is the morphology? In urticaria, fleeting wheals. In insect bite, central punctum scratch mark is the common. In erythema multiforme, urticarial plague with dusky center blisters are present in erythema multiforme. In urticarial vasculitis, we can also see the wheel-like lesions. But in resolution features, in urticaria, there is no residual skin changes. There is no skin changes, skin color changes are seen. In insect bite, marks from scratching. Due to the scratching, some marks, some skin colors changes may be seen. In erythema multiforme, post-inflammatory pigmentations, or in urticarial vasculitis, scaling, bruising pigmentations are seen. Systemic involvement, complement like normal complement, localized mucosal erosion, and often reduced complement, joints, abdominal pain. In allopathic side, some management like first step, second step, third step, fourth step. Here the generation wise the differentiation of the medicines. First, they said that they identified the trigger and avoidance that triggers to help the treatment. In the second step, non-sedating antihistamine, the first line treatment of the urticaria. In this, they give the cetirizine, levocetirizine, foxofenadine, blistadine must be taken routinely. And the third step, sedating antihistamine and targeting blockers. In this, the montelukast, hydroxyzine, diphenhydramine, or in the fourth step, the biologic immune suppression medicines can be given. There is the omalizumab, anti-IgE molecular antibody, which suppress the mast cell activity, induce the eosinophils. Some cyclosporin, fast onset, long remissions, and alternative to steroid. This is the all know we can discuss previous slide, the step 1, step 2, step 3, step 4. or the dose of some standard dose, the H1 receptors blockers in standard 2 scenario 2, the dose uplift 4x. The second generation antihistamines given the minimal cardiotoxicity and low sedations, which affect the body and endothelial receptors. On observation, observe the surface, what is the triggering factor, address, and then the step therapy. Here, we can differentiate that in allopathy, some specific medications are there. Antihistamine, corticosteroid, hydrochloride, and plasmapherin. For a localized systematic medication, they can be given. But in homeopathy, we not treat only the symptoms, we treat the patient as a whole. Urticaria is not a skin disease. It is an internal dynamic disturbance which develop on the skin on a physical expressions. According to Hahnemannian classifications, we first of all divide the disease according to classification in which area we can put the urticaria. In some cases, some internal mental psychological disturbance, some fundamental cause, miasmatic cause are there present. We can differentiate, we can put urticaria in the fully developed with miasmatic disease. In some cases, there is the only physical symptoms, only the some triggering factors are there. So we can put in one-sided disease with only physical symptoms are there. What is the role of homeopathy in this? If we treat the patient superficially on the basis of the symptoms, the basis of therapeutic way, sometimes we suppress the patient's vital force, vital immunity. Constant given the some therapeutic, some partial similar disease, some partial medications, which not cure the patient internally as a whole. Some continuous drug which destroy the natural reactivity of the patients, forces the disease energy downward and inward, locking it into the deeper chronic state. But if we given the perfect similimum medicines to match the patient's susceptibility, it stimulates the vital force to push the disease upward and outward. Dr. Stuart Close said that disease arises due to the morbid susceptibility. Cures occurs when the organism reacts positively to the right similar remedy. What is the psychological impact which triggers the urticaria? The connection between the mind and skin is the cornerstone of homeopathic philosophy. Some stress is a triggering factor like psychological stress, anxiety, emotional disturbance, anger suppressions, emotion suppressions, which triggers the both acute or chronic urticaria flares. Stress can lead to sudden outbreak with hues appearance during the period of high anxiety. Some bidirectional relationship in this. Some stress can cause hues, but continuous like suffering from the urticaria, which develop the secondary stress, anxiety, depressions, lowering the patient's quality of the life. Constitutional and emotional pictures we all find out in the unique constitution which develop the urticaria. The specific emotional state is a vital clue to selecting the right remedy. We all know about the constant suffering from the urticaria, which may affect the patient's quality of life. Day-to-day routine life may be affected by urticaria. They can't do some activities because of the constant itching are present in the body. What is the true root of urticaria? Some fundamental cause are present. Urticaria is the dynamic expression of an inherent miasmatic burden. Dr. P.S. Ortega says the dominant miasm dictates the nature, periodicity, and recurrence. SORA, psychosis, syphilis, tubercular. SORA, the foundation, the fundamental cause, hypersensitivity, and functional disturbance. In psychosis, chronicity, overgrowth, and fixed localization. In some patients, there is the fixed area. Constant fixed area or chronicity are there in the symptoms which occur on the body. In tubercular, alternating state, violent reactions. In syphilis, destructions, raw pain, and ulceration. But mostly we can see the urticaria in SORA, psychosis, and tubercular miasm. SORA, the hypersensitivity foundations. What is the soric skin appearance, modality, mental dispositions in general? There is no fixity to each and every person soric are present with these conditions, these symptoms, or this modality. Some general soric conditions and modality are the dry, porous, unhealthy skins, intense, pleasurable itching that compels scratching, followed by the prolonged burning. No pus formations are there in SORA due to the hypersensitivity, hyperreactivity. In psoriatic skin, the functional changes are there. In modality, aggravated in cold seasons, winter, undressings, and late evening, ameliorated by the natural bodily eliminated sweating. Mental dispositions, overly sensitive, easily startled, anxious, and emotionally unstable patients. Here, the differentiation about the psychosis, syphilis, tubercular. In psychosis, localized area, fixed area, shiny, greasy, flat, reddish patches appearance, chronic and recurring skin presentations. Modality, damp, rainy weather, meat intakes, ameliorated by the dry conditions. Mental and general dispositions are apathy, poor memory, detached, lack of confidence. In syphilis, rarely itching are present, raw, tender, persistent soreness are there, burning pain, destructive and ulcerative. In syphilis is aggravated by night, warmth in bed, ameliorated by pathological some discharge, dull, rigid thoughts pattern, suppressed rage, and destructive emotions are there in syphilitic. In tubercular miasm, patients are aggressive, inflamed, fluctuate with other conditions. Some other conditions are there. Some other pathological conditions are there, like asthma, aggravated by night contact pressures, greasy food, ameliorations by the open air. Tubercular patients are generally rapid mood swings, highly emotional, surprising, hopeful, and idealistic. Some homeopathic medicines, which we can see that the aggravating and ameliorated condition on their basis of be given as a therapeutic treatment to patients to relieve their conditions. In Rustox, we see that vesicular itchy eruptions worse by the cold, damp, and rest. In arsenic, dry red wheels worse from the cold. In Apis mellifica, there is the highly edematous, but opposite to the Rustox and arsenic, it's worst by the heat and warm room, where the Rustox aggravated by the cold, damp, and rest. In Pulsatilla, wandering, yielding, worst by the heat and warm room. In Delcamara, hot days followed by the cold nights. Filtering the case taking information. After the case taking, we filter all the informations general to particular, some specific modalities. We find some striking singular pictures which can help to give the perfect simillimum medicine, some perfect medicines. Here, some repertory which present some specific rubrics like in chronic, incomplete repertory, skin eruptions, urticaria, in boric, urticaria chronic, in fatigue, urticaria children. More variety of the symptoms are present in different repertories. Some other remedies like Apis mellifica, pulsatilla, sulfur, rustox, urticaria urens, sorinum, menetramur, bovista. We prescribe the medicines on the basis of symptom similarity, patient's perfect individualization. Not only the some two symptoms are present, like only basis on the modality. In the posology, the individualization constitutional remedy given in 200 in frequent dose were the most effective protocol for the long-term resolutions. If we find the perfect similimum medicines, we cure the patient as a whole from the root cause. If we given the partial similimum medicines, if we give the partial similar medicines, we only cure the some partials like surface area which cure, not a root cause cure. If the we all know about the Herring's law of the cure. The direction of the cure is the from within to outward, from above to downward. If we find the perfect similar medicines, we cure the root. We find the root cause, give the similar medicines, will cure the patient as a whole, free from the disease conditions. Now we discuss some cases to how the urticaria develop, what are the triggering factors which help to find the cause and which help us find the similar medicines. 40-year-old male patients came with me the complaint of the urticaria since 1.5 years. Episode last when the patient presents with the complaint like itching, redness of the any part of the body, not fix the body part to develop the urticaria. When the episodes occur, it lasts 30 to 40 minutes. Episodes are appears. Modality itching is aggravated by after bathing and ameliorated by taking some allopathic medicines. He took the antihistamine like levocetirizine, montelukast. In the case takings in his past history, they suffered from the jaundice in 1990. In family history, mother has suffering with eczema, father has hypertension, and brother has allergic rhinitis. Um, in the life space, I asked about her. I asked about him to about what is the life space, what are the mental symptoms. In this, they said that during his college life, worked during the college to support the family, secured bank job while setting up a factory in a partnership. After the partner deceives him, they shut down the factory, followed by failed attempt in the stock markets. In the they try to do the some job to stable her financial conditions, but after that, before the 1.5 year ago, his father suffered from the stroke and required the hospitalization. During this critical crisis, he received zero emotional support from his family, financial help from his sibling, so that he felt anger, but he can't explain the anger due to deeply attachment to the family, but introvert by nature. He felt that betrayal led to intense unexpressed resentment. He actively suppressed his severe anger and dislikes being consoled, and then developed the urticaria. In physical general, his thermal state is the hot, thirst increase specifically for large quantity of water, craving, desire spicy and salt, perspirations profuse. Mental generals element from suppressed anger, disposition is reserved, reactivity, consolation, aggravate, and conscientious, duty bound. He is the duty bound and punctual about the work and all the things. When the patient comes, we all know about the iceberg phenomena. Patients only say the only physical symptoms which affect on the body, which they can see. But after the case taking, after the history taking, we find out the what are the actual cause, what are the actual reason to develop the symptoms, to develop the disease. When the patient come, they explain the chronic redness, severe itching, inflammatory skin eruptions. But patient does not know about the exact root of the cause. But after the history taking, we find out the what are the cause to develop the disease. What are the factors which hampers the body's susceptibility, which react, which affect on the body to develop the symptoms. In this case, after the history taking, I found the element from suppressed anger, reserved natures, consolations, aggravations, duty bound. Anger is the suppressed anger is the most common cause, like causative factors to develop the urticaria. In the dominant miasm, patient's dominant miasm is the SORA, suppressed emotional energies, introvert resentment, active system involvement like inflammatory pathway, redness. So patient's dominant miasm is the SORA. SORA is the fundamental vulnerability, internal emotions, tension into the fast progressing functional disturbance. Here it is the totality of the patient's symptoms. In this, mind, anger, reserved, thirst, perspiration, skin eruptions, irritability, duty bound. After the repatriations, I found the netramure is the most minimum medicines to the patient. Netramure covers all mental generals, physical generals, particular symptoms. All the three aspects are covered by the netramure. So I gave the netramure medicines 1 ml, 1 dose when the patients come. After the follow-ups, we differentiate the symptoms, intensity of the symptoms, what are the mental dispositions, how the mental dispositions develops. 1M potency was selected due to the high intensity of the mental generals, suppressed anger and resentment driving the pathology. Vital force required a deep acting high potency stimulus to dislodge the emotional blockage. Here, the after the treatment, what are the after the treatment when the patient comes, the severity of the scores, and after the treatment, what is the scores? USA 7 score. USA 7 means the urticaria activity scores. In this, here you can appreciate in this slide urticaria activity scores. In this, the itching and hives are different column to assess the score. If the itching are present, itching severity score at 0, there is the no itching are present. Hive severity score is 0, there is number of hives is none. If I told the patients to write down the each when the patients complain the itching or hives develop, write down in book where the develop in day, how much develop, or where how much time developed for the every day. They note down, and after the 7 weeks, after the 1 week, uh, we can total about the itching severity and heal severity, then differentiate that severity score, how much the severity scores. If the itching severity score is the 1, then the mild, minimal awareness, easily tolerable itching. If the heal severity scores is the 1, number of the heals at a time 1 to 6. If the heals are present during the 1 week, yeah, the 2, 3, 4, then the heal severity scores is the 1. If the moderate itching patients does not bothersome but troubles are not there, then the itching severity score is the 2. If the heals develop between the 7 to 12, then the heal severity score is the 2. If severe, difficult to tolerate itching, continuous itching, patient can't tolerate, then the itching severity scores is the 3, and heal severity scores is more than 12, then the heal severity scores is 3. Here we can see that in the first week, when the patient come, there is the urticaria activity scores is the 24. After the treatment, in every week, I assess the urticaria activity scores. In second week, there is the 16 score. In third week, there is the 8. In 4 week, there was 4. USS 7 score is 4. And week 5, 6, 7, almost 0. Like USS 7 score is the 0. Completely cure from the itching, heals, urticaria. Patient is free from the disease conditions. Here we can appreciate that the IG IG report, like IG serum IG level, when the patients come with me, there is the IG level is the 530, and after the treatment, the IG level is the 63.1. Mark significant, we can see that in severity scores, we also can see that the mark reductions are then in pre-score and post-score. Next case, like 38 female came with me, like the complaint of the itching, redness all over the body. Duration since 3 months, and frequency of the urticaria develop every 2 to 3 days. And urticaria develops on hands, backs, and thighs. Modality are aggravated at night and after eating fermented food. After the history taking, I asked about the mental life. What are the changes are there in within 3 months or above, before the 3 months? Then she said that in Ahmedabad, before he stayed, before he lived in Ahmedabad, she can do everything like her active lifestyle. She is the dance teacher, so she doing the dancing, and she taught the dance to children. Dancing was a passion for her, but after Ahmedabad to shift Rajkot, her patience was completely closed. She can't do her activities, so that she felt that I'm stuck in this. I can't do anything. Like I can't do anything. This is the word she said to me. In this, the psychological shift, observe other woman person. She felt that other woman can do anything, feels profound sadness, in chronic frustration, weeping, severe impatience with any delays in daily schedules. Time bound, time punctual. She is the time punctual. She can't do any delayed schedules or anything. Here the totality like mental genres is the loss of ambitions, impatience, wants everything done on time, gets angry or irritated if works are delayed. Physical genres, intense thirst, 5 to 6 liters per day, strong desire for sweet, profuse perspiration, hot thermal, skin redness, itching and hives. In this case, I found the psychological trigger is the ambitions loss of because she do in past she do the dance is her passions. She enjoy dance, but after the shifting to Rajkot, she can't do any activity for the that frustrations. She felt that the my ambition is the loss of. So after the continuous these thoughts trigger in her mind, which affect on the susceptibility, vital force derange, and then develops on the physical appearance like the urticaria. After the repetizations, I found the sulfur, calcarea, and sepia. But for the sepia is the best medicines for her. Sepia is the exact archetypal match for the woman experience profound exhaustions, loss of ambitions, and resentment towards forced domestic confinement. Here the clinical intervention protocols like a sepia 1M 1 dose. After the during the follow-up, whenever required the dose, I gave the dose. When the patient's stable her conditions like itching not that much, so I gave the placebo cyclic for 7 days. In auxiliary measures, I advise her to avoid tight clothing to reduce the physical frictions and skin irritation. Here you can appreciate that the graph of the severity scores to 24 to almost the 0. Frequency and intensity reduced, no significant changes, aggravated during the second week. I gave the sepia 1M 1 dose, repeat. Then the episode reduced to once a week, and after the 8 to 9 week, even under stress, symptoms remain highly manageable. She can manage the conditions. There is the no itching. If sometimes itching develops, she can tolerable. Achieving the complete graph in 7 to 8 weeks. No frustrations, feels good and relaxed. Here we can see the itching severity score. Before, when the patients come, that is the severity score for the itching is the 12 and Hughes score is the 10. For the total 22 score. And after the treatment, the itching and Hughes score is almost 0. In this slide, IG level, we can appreciate that the IG level before treatment and IG level after the treatment. 80% reductions in serum IG levels in 8 weeks, returning to the normal biological reference. Sepia 1M, perfect similarium medicines. We can achieve the harmonious between the mind, body, and souls. Breaking the causative loop. Sepia breaking the causative factors loop. Here, the Stuart Close said that the role of the homeopath is not to remove the skin rash, but to understand why the vital force is expressing itself through the skin. Cure is only possible when the vital force is harmonized, not when the symptoms are forcibly removed. Treat the patient, not the pathology. Thank you.
Thank you. Thank you so much, Dr. Janaki, for your detailed explanation about urticaria. Your explanation was very clear and structured. And for us, it is easy to learn the urticaria in depth. Your class is very detailed. Thank you so much for your wonderful session. We have 2 minutes, I think. 2 minutes. So if anyone have questions, you can raise your hands and ask question. Within 2 minutes, you have to ask question. We have to move to the another session. Here we have some messages from, I think it's from your students. They have typed message here. Anyway, the students, we have the same kind of session every day for last 5 years. We have 3 sessions, Hindi, English, and Malayalam. So you can join every day with us. We need co-passengers for our travel. We need all of you to join in IFPH and listen and express your ideas here. Thank you so much, Dr. Janaki, once again. Thank you.
Thank you, ma'am. Thank you,
Yes,
ma'am, for this.
Dr. Janaki, it's really a very good session. You really rocked with excellent presentation. And we know that homeopathy is a science where it is entirely different from what the others are, the so-called modern science. But actually, homeopathy is super modern. That's what we would like to say to the audience, particularly the students, because we know that treating the pathology is nothing, but to treat the patient is different. Finding a different, differentiating each patient from one another is what is homeopathy. Individualizing somebody's phone is on. Kindly stop. Yes. Yes, this is what homeopathy is all about. There's a big option for all of you to practice homeopathy. If you practice homeopathy in this way, you will become great doctors, because we have so many doctors who have a consultation fee of 6,000 to 10,000, even for a single consultation. So what we would like to advise to all of you is that you just concentrate and try to treat each and every patient that comes on your way. And whatever be the disease, the name of the disease, it doesn't matter. People are more concentrating on anatomy, pathology, physiology, but as a homeopath, you need to study materia medica as well as the organon of medicine, and so that you can understand how there are different methodology of treatment for homeopathy. It's not really single remedy, but even in other advanced pathological cases, you can use different type of prescriptions. So,
Dr. Danish, we have
yes.
to keep a few
Thank
minutes.
you. Thank you. Anyway, congratulations, Dr. Janaki Hirpara.
It was so detailed, so explained, well explained, very
and a powerful presentation also.
wonderful.
That's a power. That's kind of power that will definitely bring the confidence of the patients as well as the students.
Thank
Dr.
you.
Ramparvesha, sir. We already crossed the time, even though I am giving.
Thank you, Andini, and congratulations, Dr. Janki Hirpara. Very nice, wonderful presentation. Urticaria case. Urticaria case presentation is a very good, really detailed case taking, mental, physical, and causative factor. Then select the remedy. So, very, very thanks, Dr. Janki. Again, presentation. behalf of IFPH whole team, very, very thanks.
Thank you.
Thank you.
Thank you, Dr. Ramparvesha. Thank you, Dr.
Homeopathy. Homeopathy.
Thank you, all the participants. Now we are moving to the Malayalam session. Bye-bye. See you tomorrow at the same time. Bye-bye. I am inviting Dr. Shaila for moderating Malayalam session. Dr. Shaila, you're welcome.